Anxiety disorders, a silent epidemic, impact millions worldwide. Nestled in the shadows of our society, this pervasive issue runs a broad gamut from generalized anxiety disorder to panic disorder, social anxiety, and beyond. It's an invisible battle waged within the minds of countless individuals, often misunderstood and underestimated. Anxiety disorders aren't merely about having a case of the jitters before a big presentation, or feeling butterflies fluttering in your stomach on a first date. No, they delve much deeper, seeping into the very fabric of daily lives, disrupting routines and eroding peace of mind. They're relentless, irrational fears and worries that persist, often ballooning out of proportion and spiraling out of control. These disorders are not about feeling a little nervous or having some worries. They're about a constant state of apprehension, a ceaseless worry that's always lurking in the background, ready to spring forth. Anxiety disorders are more than just feeling nervous or worried. They can be debilitating and significantly impact a person's daily life. Everyone worries from time to time, but when does it cross the line into an anxiety disorder? This question is more important than ever, as the line between normal stress and clinical anxiety often seems blurred. Let's first consider everyday worries. These are the typical concerns we all face, like fretting over a big presentation at work or worrying about a loved one's health. These worries are usually tied to specific situations or problems, and they tend to subside once the situation is resolved. Importantly, while they may cause temporary stress, they don't significantly disrupt our daily lives or prevent us from enjoying our favorite activities. Now, imagine you're constantly worried, not about anything in particular, but rather a vague, looming sense of impending doom. You can't shake off this worry no matter how hard you try. It's like a background noise that never goes away, interfering with your ability to work, study, or even relax. This is what clinical anxiety feels like. Unlike everyday worries, clinical anxiety is not necessarily linked to specific events or situations. It can seem irrational, disproportionate, and persistently intrusive. The worries are excessive and long-lasting, often stretching over a period of 6 months or more. They're not just a response to stress, but a chronic condition that can make the simplest tasks feel insurmountable. And it's not just the mental toll. Clinical anxiety can also manifest physically, causing symptoms like heart palpitations, shortness of breath, and sleep disturbances. It can lead to avoidance behaviors, where individuals go out of their way to avoid situations that trigger their anxiety, further disrupting their life. So, when we compare everyday worries and clinical anxiety, it's like comparing a drizzle to a thunderstorm. Both involve rain, but one is a temporary inconvenience, while the other can be disruptive and even dangerous. The key difference between everyday worries and clinical anxiety is the severity and duration of the worry, as well as its impact on one's life. Understanding this difference is the first step towards recognizing and addressing anxiety disorders. Anxiety disorders can be triggered by a variety of factors and present with a wide array of symptoms. To unravel this complex web, let's start by delving into the common triggers of anxiety disorders. Stress is a major player. It's like a pressure cooker that amplifies our worries and fears. Whether it's the stress from work, school, or relationships, it can push our anxiety levels into overdrive. Then, there's trauma. Experiencing or witnessing a traumatic event can leave a lasting imprint on our psyche, sparking anxiety disorders like post-traumatic stress disorder. This includes incidents such as car accidents, natural disasters, or personal assaults. Let's not forget about genetic factors. Just like the color of our eyes or the shape of our nose, our susceptibility to anxiety can be inherited. It's not a certainty, but if a close family member struggles with anxiety, you might be more prone to it as well. Now let's shift our focus to the common symptoms of anxiety. Restlessness is a classic one. It's like having a motor that just won't stop running. You feel keyed up, on edge, unable to sit still. Difficulty concentrating is another symptom. It's as if your thoughts are on a continuous loop, and you can't seem to turn it off. The constant worry makes it hard to focus on anything else. And then there's sleep problems. You might find it hard to fall asleep, or you wake up frequently throughout the night. The lack of restorative sleep can leave you feeling exhausted and exacerbate your anxiety. Anxiety is a multifaceted beast, with different triggers and symptoms for different people. But the key takeaway here is this. If you're experiencing these triggers or symptoms, you're not alone. You're part of a large community of people grappling with similar issues. Understanding the triggers and symptoms of anxiety is the first step in managing it effectively. Remember, recognizing what you're experiencing is not a sign of weakness, but a display of strength and self-awareness. And it's this understanding that paves the way towards finding the right tools and strategies to manage your anxiety. While anxiety can be overwhelming, it's important to know that effective treatments are available. And the first type of treatment I want to delve into is therapy. Specifically, there's a form of therapy called cognitive behavioral therapy, often abbreviated as CBT. Now, what exactly is CBT? It's a type of talk therapy that allows you to become aware of inaccurate or negative thinking. It helps you to view challenging situations more clearly and respond to them effectively. Imagine a pair of glasses. Without them, everything might seem blurry, confusing, or even scary. But slip those glasses on and you can see clearly. That's what CBT is like for your thoughts. It's like slipping on a pair of glasses that help you see your thoughts and fears more clearly. Numerous studies have shown that CBT can significantly reduce the symptoms of anxiety. It's not a quick fix, though. It requires dedication and consistency. But the result? A more balanced perspective on your fears and worries. Now let's talk about medication. Medication for anxiety comes in various forms, and it's often used in conjunction with therapy. It's like having a helping hand to guide you along the path to recovery. Medication can help manage severe symptoms, so you can focus on therapeutic techniques to address the root cause of your anxiety. However, it's crucial to remember that medication should always be taken under the guidance of a healthcare professional. This is because everyone's body reacts differently to medication, and what works for one person may not work for another. The combination of therapy and medication can be a powerful tool in managing anxiety. It's like having a 1-2 punch to combat those overwhelming feelings of worry and fear. But remember, it's not about getting rid of anxiety completely. It's about learning to manage it so it doesn't control your life. Remember, seeking help is a sign of strength, not weakness. There are effective treatments available that can greatly reduce anxiety symptoms. You're not alone in this journey. Reach out, seek help, and take the first step towards a life where anxiety doesn't call the shots. In addition to professional help, there are a variety of self-help techniques that can be used to manage anxiety. Each person's experience with anxiety is unique, and so it's essential to find the methods that work best for you. Let's start with deep breathing exercises. This technique is a great way to calm the nervous system, reduce stress, and manage anxiety symptoms. It involves taking slow, deep breaths, holding them for a few seconds, and then slowly exhaling. This process can be repeated as often as needed until you start to feel calmer. Next up is progressive muscle relaxation. This technique involves tensing and then relaxing each muscle group in your body, starting from your toes and working your way up to your head. Progressive muscle relaxation can help you become more aware of physical sensations and achieve a state of deep relaxation. Mindfulness is another effective technique for managing anxiety. It involves paying attention to the present moment without judgment. You can practice mindfulness in various ways, such as through meditation, yoga, or simply by taking a moment to focus on your surroundings. The practice of mindfulness can help you to stay grounded and prevent getting caught up in anxious thoughts. Regular exercise is also a vital part of managing anxiety. Physical activity releases endorphins, the body's natural mood boosters, and can help to reduce anxiety symptoms. Whether it's a brisk walk, a yoga session, or a vigorous workout, find an activity you enjoy and make it a part of your routine. Lastly, don't underestimate the power of a balanced diet and good sleep. These two factors play a significant role in regulating mood and keeping anxiety at bay. Remember, these techniques are not a substitute for professional help, but they can be powerful tools in your anxiety management toolbox. It's okay to seek help, and it's okay to take care of yourself. Managing anxiety is possible, and with the right tools and support, you can lead a fulfilling and happy life. We hope you enjoyed today's important topic. Please remember to give us a thumbs up, subscribe to this channel, and tap the notification bell for new content below. Enjoy the rest of your day.